HealthWish is a series of conversations about the state of healthcare in New York City's fabulous fifth borough, Staten Island. Our goal is to raise issues, raise awareness, and raise health. Because when we raise health, we raise everyone. Having a compassionate doctor help with pain is great. Having two doctors is even better. Join us with brothers Michael and Frank Sharippa in their brand new pain management offices located on the South Shore of Staten Island. Give it a listen.
I have sent multiple patients to this practice, and it is very interesting to me, and one of the reasons that I genuinely like referring patients to this practice is the continuity. You all have a pretty amazing relationship with your referral base. Tell me a little bit about that spectrum, especially for people with chronic back pain that is kind of procedural in nature.
We have excellent relationships with our orthopedic colleagues, neurosurgical colleagues in the community. And yeah, when the patient may have failed conservative management and there's a serious nerve palsy that, injection therapy is not going to be the answer for them, we are able to get patients into their offices, these surgical colleagues, immediately. So the care from our office to the surgeon's office is seamless. There's no loss to follow-up. Patients love that. It's very efficient, and they get their treatment, their surgery, quickly. For example, Dr. Rasuli performs complex spine surgery, so patients that have been operated on prior and they have a very complex back, we have somebody that is excellent in that regard, and so patients can feel very confident coming to us. We're referring them to excellent people.
We literally have a messaging system with the Northwell people. We can task the doctor, we can Microsoft Teams them, and we got them in within a day, 2 days, 3 days. Not just surgery. We have rheumatology. I send Dr. Slobodnik a message. Cardiology, Dr. Weinberg, vascular.
Yeah. Especially when you're in pain, right? You don't want to be waiting for weeks and weeks to see doctors and have their treatment commence.
It is kind of neat to have this and to have something of this complexity and this plugged in right in the South Shore of Staten Island. But there is something very particular about this place.
Yeah, I agree. I mean, it is interesting. I feel like patients that live on the South Shore, they don't really like to go to the North Shore. But yeah, Frank identified this area to be a great location for an office, and this is the vision that has finally commenced. And it's been great. Patients, I think they love the convenience of living here and coming to this building. We have parking. It's an excellent building. It's a multi-specialty building as well. We have primary care physicians and other people that are practicing throughout the 101 Tyrell building.
Just to add, we have a lot of retirees moving to South Jersey, and they're coming back here because we're so close to the bridge.
We were talking about this piece of equipment behind you, which is right in between us. It's called a C-arm that allows you to really get some pretty neat images. Tell us what that is and kind of what kinds of things you're able to do with it.
We can literally pinpoint exact pain generators, whether it be a small joint cyst or a pinched nerve, and we correlate the MRI with their physical exam and use this, and we can inject a little steroid and we can calm that pain down. Without that, it would be impossible to do that type of job.
And it allows us in real time to place the needle into the exact location where the pain is coming from and
because
deliver medicine. Because you can see it. And it's extremely safe for patients. And using this machine, we deliver different types of medications, whether it's steroid or other things, but we have special needles as well that can go into the spine, and we can ablate or burn nerves that give patients long-lasting relief.
I'd love for you each to tell me your favorite patient success story that you've had since you've been doing this here.
I had a patient who had a head injury 3 years ago, saw multiple neurologists and couldn't really get this pain under control, and it was debilitating. She was a nurse, 10 out of 10 pain. I assessed her, examined her, took the history, and I came up with the diagnosis of occipital neuralgia, which is a pinched nerve in the back of the head. I did a simple steroid injection around the nerve, and she's been 100% pain-free for the last 2.5, 3 years now. And again, that's just, it's not even that sophisticated of an injection, honestly. It's just really the listening, examining, that really made the world of a difference. And she was suffering for years with this.
Headaches can be so incredibly debilitating, and by making a diagnosis and doing a simple injection, you change that woman's life.
I think most pain doctors out there know about spinal cord stimulators, but for the general public, there are patients out there that have had surgeries in the back, and unfortunately sometimes they have chronic nerve pain after the fact. And I have one patient in mind that just a few months ago He had a nerve injury. We call it CRPS, causalgia. It is sort of rare. His leg was purple. He had tremendous pain down the left side of his leg. We actually place a wire, a lead, almost like a pacemaker that patients have for their heart, but we use it for the spine, for the nerves in the back. And the patient had 80% relief, 80 to 90% relief, and he's doing tremendously well. I just saw him last week. And so you could see, it's very rewarding when you have cases like this where patients have been suffering for years and their quality of life has suffered, their functional status. He had told me, specifically that he can't really play and spend time with his grandkids. He can't get on the floor because of this pain, and now he can do that.
I'm really happy you brought that up. And if you watch your Health Wishes, when we spoke to Dr. Rasuli at Monsignor Farrell, it was really enlightening to me. The full spectrum, from what you're doing in pain management all the way to potential need for surgery, a lot of those folks who had those failed back surgeries back in the day, there are actually things that can be done to help those people. But we've learned so much about the structure of the back, and we've learned so much about how the bones attach to each other, and learned so much about natural configuration and nerves, that now, if there's somebody out there suffering from an old back surgery and they feel like nothing can be done for them, there's actually a decent chance that between pain management and surgery, that there might be something to help them.
Absolutely. I think there's some optimism.
And there's at least reason to reevaluate and consider. Exactly. Not every single person can be helped, but there's a lot of people who can be helped.
But if we can get you significant relief so you can enjoy your life, that's the expectation we try to give them.
Yeah. Our sort of philosophy is identifying exactly what the patient needs and what their normal functional status is. How can we improve their quality of life? Sometimes, unfortunately, patients have injuries and it can be chronic. But if we can restore some quality to their life and restore some of their functional status, simple things like that make a world of a difference. And that's what drives us. That's why we love the field, and we're excited every day to come to work.
Yeah, listen, whatever it is that brings you joy in your life, I mean, whether it's playing with your grandchildren, being able to take your dog out for a walk, I mean, that for me is a big message coming out of this. If you're out there and you have had pain for a long time and you haven't been evaluated in a while, medicine is not the same as it was when it comes to back pain as it was 10 or 15 years ago. You can come see one of these two gentlemen, but at least give yourself another chance. Just to remind everybody, we are at 101 Tyrellen Avenue in the South Shore of Staten Island. Great location. I'm sure many of you have shopped nearby. I want to thank you both for being here and really welcome you back to Staten Island. It's been a little while, but we're so incredibly pleased to have you back. And remember, Staten Island, we're always here for you. Stay on Staten Island, get the best possible health care you can actually get. Look forward to seeing you. Bye, Staten Island.
HealthWish wishes to thank our special guests, Dr. Brahim Ardolik, Dr. Michael Shrippa, and Dr. Frank Shrippa, recorded at 101 Tyrellen Avenue, Staten Island. We're very interested in your health wish. Contact us at healthwish@northwell.edu. Thanks for joining us. We hope to see you again soon.